The Distinguished Service Award is the AHA's highest honor. And this year we pay tribute to Karen Davis, whose integrity, scholarly insights, and passion for our vulnerable populations has been a driving force in the health policy arena. For 40 years, Karen Davis has used her training as an economist to pursue healthcare coverage for all and to challenge the healthcare field to improve performance and quality. Since her early work at the Brookings Institution and as Deputy Assistant Secretary at the Department of Health and Human Services, Karen has used data and research to advocate for insurance coverage for the underserved. In 1995, Karen took the helm of the Commonwealth Fund and reoriented the fund's focus on moving the U.S. toward a high-performing health system. Hallmarks of her tenure include pushing for patient-centered care, creating comparative databases, and identifying health system innovations. Karen's precise and insightful analyses during the development of the Affordable Care Act gave policymakers an objective, data-driven voice on which to rely. As a leader, scholar, and teacher, Karen has sought to help health systems focus on performance and value, and to help individuals lead healthy lives. So from the AHA Board and the nation's hospitals, congratulations.
She's one of the most brilliant and insightful people that you can ever work for. Well, she certainly was a role model in her days at Johns Hopkins for just generations of women. Many people have told me that they entered careers in health policy because they took Karen's course or had Karen as an advisor. She's clearly picked out issues that were relevant, and she really changed the way people thought about health policy as an academic discipline.
Karen is an incredible leader. She has a wonderful vision. I think she has, and the Commonwealth Fund have moved our discussion along to re-engineering care and paying for a different kind of care that decreased costs and increased quality for individual patients and for population cohorts.
She's put this incredible emphasis on high-performance health systems, creating a framework in which the hospitals really can begin to measure and hold a mirror up to our performance overall. And I think that's a very important contribution to the field. You know, we're doing a lot of that work now with hospitals in pursuit of excellence. And when you think about the impetus for moving down that pathway, it's exactly the agenda that Karen has had for at least a decade at the Commonwealth Fund.
Karen proved to be a terrific executive. She's not a micromanager, and yet she gets very involved in things that are going on. She's a wonderful delegator. She's amazingly informed on what's happening throughout the organization. But above all, she has a vision for what the organization can be and do.
Karen is a scholar. She is a distinguished economist. She looks at issues analytically. She's also a person of incredible warmth. She has her Oklahoma roots that she brings into every conversation. So working with Karen is such a delightful experience because it's always challenging. She will always ask the toughest questions and ask precisely what do the data tell us. But it's always in a sense of personal connection and deep caring for people. I mean, she understands the reason we're all connected with the healthcare community is to serve people.
One of the great things about my childhood growing up on a wheat farm in Oklahoma was being a member of the 4-H club. This was a great opportunity for a young person to actually be involved in competitions that honed one's analytic reasoning. So I was the International Meat Judging Champion at the American Royal in Kansas City. The motto of the 4-H Club were the 4 H's: dedicating your head to better thinking, your heart to service, your hands to action, to doing, your health to better living. It certainly shapes my current work. I've always been guided by a very simple philosophy, is that everybody who needs care ought to be able to get health care. That seems pretty simple, but for me, it's just a tragedy that there are diseases that we can't cure, that we don't really know what causes certain forms of cancer, and that we can't really always defeat cancer. But if there are things that we know how to do, and we don't do them, and people die as a result or are disabled as a result. That, to me, just seems unforgivable. We ought to make it possible for everyone in this country to have access to the finest health care that's available. I think for the next decade, the big issue again is going to be Medicare. I'm optimistic that we will move forward with implementation of the Affordable Care Act, and we will begin a march toward achieving a high-performance health system and begin to reward hospitals that are trying to do the right thing for patients. I obviously care a lot about my work and throw a lot into my work, but I also care a lot about my family. I have two wonderful grandsons who are now 17 and 14, and it makes you young again when you're responsible for young people and get out on that bicycle or get out and run or play tennis or whatever they want to do. Well, I was so thrilled when Rich called me and announced that the American Hospital Association had decided to give me this marvelous award. Obviously, many of my heroes have received this award in the past, people like Dr. Jim Mongan, Gail Ward, and many others. So it's humbling to be asked to follow in those footsteps. I feel privileged, and it makes me feel good about the work that I've been committed to over time, that others share that passion for seeing that those who need health care get it.